The 7-month initial enrollment period IEP is the easiest and most effective way for an individual that is Medicare eligible to enroll into their Medicare Part A and Part B. See, if the individual is drawing Social Security, SS, or Railroad Retirement Benefits, RRB, they will automatically be enrolled into Medicare Part A and Part B for the first day of their 65th birth month. There's nothing that they have to do. Individuals are automatically enrolled because the federal government can easily withhold the Part B premium of the $148.50 that's standard in 2021 from their retirement benefits. There's no need for the individual to set up a payment plan because it's automatic and Social Security ends up just deducting that from the benefit check. So when will my Medicare card arrive when automatic? That's a question that we get a lot here at Healthcare Solutions Direct. So the Medicare card will arrive automatically in the mail approximately 3 months, 90 days before the individual's effective date. So there's nothing that needs to be done to enroll or request the Medicare Part A and Part B when turning 65. A Medicare rule is that if an individual is born on the first of the month, their Medicare Part A and B effective date will start on the first of the previous month. So let me repeat that again. A Medicare rule is that if an individual is born on the first of the month, their Medicare Part A and Part B effective date will start on the first of the previous month. So let me give you an example. Say an individual is born on July 1st. They would have an effective date for their Medicare Part A and Part B of June 1st, the previous month. So understanding when to apply during the 7-month initial enrollment period is key. So if an individual needs to enroll into Medicare Part A and or Part B because they're not receiving Social Security retirement benefits at the age of 65, they will need to apply during this 7-month initial enrollment period IEP. It will not be automatic for them. We've seen a lot of individuals that have made a mistake thinking that it would be automatic, but they weren't receiving Social Security retirement benefits, and so it's not automatic. They have to apply. So Medicare can be applied for over the phone by calling Social Security, but the federal government does not recommend that. It's recommended that the individual apply online for their Medicare benefits at ssa.gov anytime during their 7-month initial enrollment period. The initial enrollment period is as follows. Enroll as early as 3 months, 90 days before the month that you're turning 65. You can enroll in the month that you're turning 65, and you can also enroll up to 3 months, 90 days after the month that you're turning 65. Now, one thing that we recommend, if you're looking to apply for your Medicare Part A and or Part B, please give us a call here at Healthcare Solutions Direct. We know how stressful that can be. We have our client experience group that can hold your hand over the phone and actually walk you right through the application process with socialsecurity.gov. So please give us a call if you need some help with that. We're standing by to help you with that. We're going to recommend this. Enroll as soon as possible during your 90-day IEP window. You see, Medicare Part A and or Part B effective date will be effective the first day of someone's 65th birth month, regardless of how early or late someone enrolls in that 90-day window leading up to their 65th birthday. So here is where we highly recommend that you, the individual, enroll as soon as possible in that 90-day window when it's first available. This is because it can take 3 to 4 weeks to get the Medicare Part A and or Part B card in the mail. The individual cannot anticipate natural disasters or extenuating circumstances that could cause a delay. The sooner someone enrolls, the better it is for them. What we found during the pandemic, unfortunately, is for those that were needing to apply for their Medicare that delayed it and didn't do it as soon as possible when that 90-day window opened up, they found themselves with a delay with their Medicare. So as soon as that 90-day window is open to you, please apply for your Medicare Part A and Part B. Please give us a call so that we can actually walk you right through that entire process. Again, you can apply anytime in those 3 months leading up to your 65th birthday for it to start on the first day of your birth month. If you don't do it, it will be delayed. And so let's talk about the delay right now. Here are the rules for the initial enrollment period IEP delayed start. A lot of individuals don't realize that there can be a delay to your Medicare if you don't do it in those 90 days leading up to your 65th birth month. So if an individual enrolls in Medicare the month that they turn 65 or anytime during the last 3 months of their initial enrollment period IEP, they will find that their Medicare Part A and or Part B start date will be delayed. This is a Medicare rule that doesn't make any sense, but this is overseen by the Centers for Medicare and Medicaid Services, and they will not bend it. Medicare has some weird rules, and this is actually one of them that just doesn't make any sense. Medicare will delay the individual start date based on the month that they decide to enroll. It's always best to enroll in Medicare during what? The 90 days prior to turning 65, as not to delay the coverage start date. Let's talk about the breakdown of the START IEP so that you are fully aware. So if an individual enrolls into Medicare Part A and or Part B during the month that they turn 65, their Medicare will start on the first of the next month. If the individual enrolls into Medicare Part A and or Part B 1 month after they turn 65, I mean, you can still apply, their Medicare will not start until the first of the second month, so it's delayed 2 months down the road. If an individual enrolls into Medicare Part A and or Part B 2 months after they turn 65, their Medicare will start on the first of the third month. It'll be delayed. And then lastly, if the individual enrolls into Medicare Part A and or Part B 3 months after they turn 65, because remember, you have 3 months before, the month of, and 3 months after, if you apply during that last month, the third month, the Medicare will not start until the first of the third month down the road. So again, if you have any questions about this, please give us a call here at Healthcare Solution Direct so that we can kind of walk you right through this. Make sure that if you are applying during the month you turn 65 or 3 months thereafter, that we can exactly tell you exactly when your Medicare will start and help you through that process. Let's talk about the Medicare Special Enrollment Period, SEP, which is the second way that someone can get their Medicare A and B. So the Medicare Special Enrollment SEP is for that individual that did not enroll during the 7-month initial enrollment period, IEP, but has a valid reason that is recognized by the federal government. This is where people get really confused, and so we're going to help make you an expert here. The only valid reason the federal government will accept is that the individual or their spouse was working and they were covered by their current employer's group insurance. Let me say that again because this is really, really key. The only valid reason the federal government will accept an SEP is if that individual or their spouse was working and they were covered by their current employer's group insurance. See, many individuals have found themselves without an SEP because they thought that they could keep a previous employer's group insurance past the age of 65, and that would count as credible coverage. That will not count as credible coverage. In order to get an SEP after you turn 65, you or your spouse must still be working and you must be covered under that current employer's group coverage. The key wording by the federal government is that it must be based on current employer's group insurance. Let's talk a little bit more about the special enrollment period requirements. Special enrollment period requires documentation. So an individual that wants to enroll after their 7-month initial enrollment period, IEP, must provide valid documentation to Social Security that is accepted for enrollment into a special enrollment period, SEP. The requirement that CMS has in place for a special enrollment period, SEP, is that the individual must be covered, again, by a group health insurance plan that is based on their current employment if the following are satisfied. So here are the two things that satisfy it. The individual or their spouse or family member or if they're disabled is working. So again, the individual or their spouse or family member, if they were disabled, is working. The second is the individual is covered by a group health insurance plan through the employer or union that is based on where they are working. So again, to recap that, the individual or their spouse must be working after the age of 65, and that individual or their spouse must be covered under that employer's group insurance plan. Social Security will require that a form be filled out by the current employer showing that the individual or spouse was currently working for that company and was covered by that group insurance plan. So there are two reasons why someone might want to delay their IEP. So again, it's highly recommended that an individual enrolls in a Medicare Part A or B during their 7-month initial enrollment period. I can't make that any more clear. It's important to apply during your initial enrollment period because of the stress that's involved during an SEP. We've seen it so many times from clients of ours that waited until after their 7-month initial enrollment period, and the stress that came with that was quite a bit. So we don't want that to happen to you. But there are 2 reasons that would be valid to have an SEP and not apply during your initial enrollment period. So if there's a dependent under the age of 65 that's on the group insurance coverage that would be effective, that might be a valid reason to hold off on applying for Medicare. So again, if there's a dependent under the age of 65 that's on that group health insurance plan and they would be affected, they would be canceled if that individual went ahead and applied for Medicare, that might be a valid reason to go ahead and wait for an SEP down the road. The second reason is if the individual is taking high-cost brand name or specialty medication that's more cost-effective under the group employer insurance plan. We'll talk about that a lot more in our Part D video about the costs that are associated, but some group insurance plans will have a better coverage for brand name medications that you might find that are not on a Part D standalone PDP or under an MAPD. So those are the only 2 reasons that we would say are valid reasons not to apply during the initial enrollment period is if A, there's a dependent on the coverage that might be affected by it if that insurance was canceled, or 2, if that individual was taking some high-cost brand name medication that would be better covered under their group insurance plan. But again, if you have any questions on either of these 2 things, that's what we're here for. We've helped thousands of beneficiaries make sure that they're making the right decision, because during your IEP, you have to make sure that you're doing the right thing for you. Let's recap right now some reasons why someone should use an SEP as a very last resort. So again, we're recommending that you apply during your IEP initial enrollment period. Do not exercise an SEP. So the first reason an individual should enroll during their 7-month initial enrollment period IEP is that the standard Medicare Part B premium for 2021 is only $148.50 per month. Now that does fluctuate every single year, but it usually stays pretty close in line. But for right now, it's $148.50 per month. It could also be more cost effective for the individual to pay the $148.50 per month and choose a 0 premium MAPD plan, or purchase a Medigap supplement plan with a standalone PDP. Again, that's what we're here for at Healthcare Solutions Direct, is to point you in the right direction that's best for you. So enrolling during that 7-month initial enrollment period IEP will also avoid having to get the necessary documents together through the current employer for a special enrollment SEP. We've seen so many clients that had a problem getting that document from their former employer, and it caused a delay in their Medicare. So that should be a last resort. It will also avoid the problems and the stress of having to rely on Social Security to process the documents in time for that effective date that the individual needs their Medicare to start. So frequently, we've talked about this previously, an individual applying for a special enrollment SEP, from what we've seen, needs the coverage to start within 30 days, and that can be very, very stressful. So let's talk about how to apply for an SEP with Social Security. So number 1, the individual can request a special enrollment SEP anytime within the 90-day window prior to the month that they want their Medicare Part A and Part B effective date to start. So again, if you're looking for an SEP and you're over 65 years old, you can apply for your Medicare Part A and or B anytime within 90 days of coverage for your Medicare, when you know that you're either going to retire or you're going to lose that insurance coverage. Number 2, the individual does not need to wait to enroll into a special enrollment SEP just because their employer coverage is ending. The individual can enroll with a valid SEP anytime they would like their effective date to start. So again, if you're over the age of 65 and you're still working, you don't need to wait for your group insurance to end or for you to stop working. You can decide to take Medicare at any time after the age of 65 with a valid SEP. And then number 3, Medicare provides a special enrollment period SEP up to 8 months after the individual's employment or coverage ends. So again, Medicare gives you a path where you can apply anytime 90 days before you need the coverage to start. But if you were to lose the employment or you were to quit, Medicare does give the individual 8 months after they lose that coverage or they quit their job to be able to get an SEP. So there are several different ways in order to get that. Again, if you have any questions about that, that's what we're here for at Healthcare Solution Direct, is to make sure that you're pointing in the right direction so you've got all the facts that you need for your current situation so you're not making a mistake. So how to submit the forms to Social Security for SEP is a very big question that we get all the time here at Healthcare Solution Direct. So currently, Social Security requires an individual to provide what's called a form CMS L564. Again, Medicare doesn't make any sense. This form is a request for employment information. It must be filled out by the Employment Benefits Coordinator. We have those forms here at Healthcare Solution Direct, so please call us if you need that. We can get that over to you immediately. And they're also going to need a signed form CMS 40B. It's an application for enrollment in Medicare Part B medical insurance that you'll actually fill out. Good thing I'll tell you in a second is that it can all be done online by the individual. So there are 3 ways that someone can provide these forms to Social Security. Uploading the form is recommended, and it's the most convenient and effective way. We can actually help walk you right through that step. But you can actually upload the CMS L564 form and electronically fill out that CMS 40B form in the remarks section. What you would do in the remarks section is this. You would state, I want my Part B coverage to begin on this month and this year, by going to ssa.gov and choosing Medicare Enrollment and clicking on Apply Online for Medicare Part B during a special enrollment period. Again, I'll repeat that if you need to rewind and listen to it again. You can upload the CMS L564 form and electronically fill out the CMS 40B form. And in the remarks section, you would state, I want Part B coverage to begin the month and the year. And you would do that at ssa.gov. When you get to ssa.gov, you're going to click on choose it. You choose Medicare Enrollment on the front page. You would click on Apply for Medicare Part B during a special enrollment period, and that would take you to the next screen where you can upload your form, fill in the remarks section, and then submit it. It's super, super easy. But again, we're here at Healthcare Solution Direct to make this as simple as 1, 2, 3. Don't do it on your own. Give us a call so we can kind of walk you right through those steps and make sure that you're doing it exactly the right way. You can also fax the forms to Social Security. You can mail the form into your local Social Security office. I would not recommend that. A fax, something can get lost, something in the mail could get lost. Give us a call so we can help you walk through the online portion of it. So there is another SEP that actually has nothing to do with the Medicare A and B. And I'm going to talk about this really, really quickly. The 63-day special enrollment SEP, which has nothing to do with enrolling into Medicare A and B or Social Security, but it's important for an individual to be aware of this if they have a Medicare Advantage plan or a standalone prescription drug plan, PDP. So it doesn't matter if you have a Medicare Advantage plan or you have original Medicare with a standalone PDP. It's really important that you actually understand the 63-day special enrollment. Again, I'm going to preface it. This has nothing to do with original Medicare A and B enrollment. We're kind of going off topic for just a minor second, but we'll be right back to it. See, when someone's already enrolled into both Medicare Part A and Part B, they may be eligible for what is referred to as a 63-day SEP after they involuntarily lose the coverage for a Medicare Advantage Part C or a standalone Part D. So the reason this enrollment period is so important is that there is a penalty if someone goes without credible prescription drug coverage for a continuous period of more than 63 days. So the 63-day SEP is a protection that CMS gives to an individual to make sure that they always have coverage in place for their prescription drug coverage. If they move out of a coverage area with their Medicare Advantage plan, it would also hold true with their PDP plan. If you moved out of a coverage area, you would have to get a PDP standalone prescription drug plan for that area. Or if there's an involuntary loss of coverage as well. So let me give you an example to kind of further drive home the point, an example of a 63-day SEP for loss of coverage. So if an individual moves out of a coverage area of their Medicare Advantage plan, or let's say the plan stopped offering coverage in that individual's area, the individual would have a 63-day SEP to enroll into another MAPD, an MA, or a standalone PDP. So let me give you an example. An individual moves from Florida to Texas and their current plan with their Medicare Advantage plan or their Part D drug plan will not cover the area of Texas. That would now give them an SEP. So if an individual moved out of that coverage area with their standalone PDP, this would give them that 63-day to enroll into another standalone PDP plan or if they had a Medicare Advantage plan from, say, Florida, they moved to Texas, they'd want to get an MAPD plan that covered that area of Texas because they'd be out of the coverage area. So again, to make it easy, an individual has just two options that they will have for their 63-day enrollment period. Is they have a PD please standalone, they move out of the coverage area, or that coverage is canceled, or they have a Medicare Advantage plan that either they move out of that coverage area or it's no longer offered in their area. They'll have a 63-day SEP. We're going to talk about the last enrollment period. So we've talked about the initial IEP, the 7-month, and how important that is. We've talked about the SEP, the special enrollment period after the age of 65, how important that is to make sure that you're making the right decisions with either of those two enrollment periods. If the decision is not made correctly during the initial enrollment period or the SEP, the individual might fall into this last category, which is called the Medicare General Enrollment Period, GEP, which I would call the last resort. So if an individual that's eligible for Medicare did not enroll into their Medicare Part B during the 7-month initial enrollment period IEP, and they don't have a valid special enrollment SEP, they will have this last enrollment period available to them. To make this really easy to remember, you can think of the general enrollment period SEP as the naughty list. Call it the naughty list. This can be referred to as the naughty list because the individual would have a lifetime late enrollment penalty for their Medicare Part B of 10% for each full year that they delayed signing up for it. So they would also have a delay in their Medicare Part A and B effective date and when it would actually start. So here's what would happen during the general enrollment period that's available every year. So general enrollment period, GEP, runs every year for the Part B between January 1st through March 31st, but here's the problem. The effective date won't be until July 1st. Again, that's Medicare's rule, is that the general enrollment period falls between January 1st and March 31st. There's no documentation that's needed. Anyone can apply during that time period, but the effective date will not be until July 1st. So this enrollment period is typically for someone over the age of 65 that never enrolled into Medicare Part B during their 7-month initial enrollment period IEP, and they do not have a valid special enrollment period SEP. So this affects about 1.5% of Medicare beneficiaries. So when you think about how many Medicare beneficiaries there are, 1.5% is a big number. So again, please reach out to us here at Healthcare Solutions Direct so that we can make sure that you're not one of that 1.5% that fall into this category. You make the right decision during your IEP or during your SEP so that you're doing the right thing exactly for you. So during this time period for the GEP, there is no supporting documentation that's required for someone enrolled during the first 3 months of the calendar year. But again, there's a delay to the Part B coverage as well as there's a pretty hefty penalty that would follow someone for, unfortunately, their lifetime. So let's understand how this Part B penalty works. A lot of people don't understand how the Part B penalty actually works. So the general enrollment period GEP would have a 10% penalty for each 12-month period that the individual delayed their Medicare Part B enrollment. So I want to give you a quick example right here of this, which is a big misunderstanding so that you become a Medicare expert. A VA member who did not enroll during their 7-month initial enrollment period IEP and does not have a valid special enrollment SEP would also be penalized a 10% penalty just like everybody else. We'll talk about VA members and exactly what they should do in our insurance videos, but right now a VA member that does not take advantage of the 7-month initial enrollment period IEP, doesn't have a special enrollment SEP, would also fall into this category of the GEP. We've seen a lot of VA members, unfortunately, that did not sign up during their IEP, that wanted Medicare down the road, and unfortunately, the only time they could sign up was during this enrollment period, the GEP, if they wanted to take their Medicare. So here's how Medicare would calculate the 10% penalty during the general enrollment period GEP. So it's really important because you won't find this in many places. So let me give you an example. So let's say that someone delayed their Part B for 4 years and they signed up during the GEP in 2021. So we'll use 2021 as an example, but they delayed it for 4 years. So it'd be $148.50, which is the standard Part B premium for 2021, times 0.4%. So the penalty would be $59.40 in this example for someone that delayed it for 4 years. So it'd be $59.40. So what Social Security would do is they would take the $148.50, the standard premium, they would add the $59.40, the penalty. So now this individual has their Medicare Part B that's now going to cost them $207.90 in this example, and that penalty will follow them for the rest of their life. As well as when the Part B premium starts going up a little bit over the years, that will also fluctuate with the penalty. So it will always keep moving up. So make sure that you're making the right decision when it comes down to your health insurance coverage so that you don't fall into this category of a GEP. Again, we're here to make sure that this does not happen to you. We're just a phone call away. Please give us a call here at Healthcare Solutions Direct so that we make sure that you understand the initial enrollment period, the SEP, and the GEP, and how all three of those enrollment periods would affect you, because those are the only three ways that anybody here in the United States can actually sign up for Medicare. So it's important that you really, really understand that. So I would recommend that you watch this video again so that you become a Medicare expert when it comes to the initial enrollment period, the delay that comes with the initial enrollment period, also the SEP, so you can understand a little bit more about the SEP side of it, and then the GEP, the naughty list that we don't want to be a part of. So look forward to hearing from you.